Children are not just small adults. Their bodies are unique and require special consideration when it comes to medical treatment. Their bodies handle medications differently, which means that the same drug can have different effects in children compared to adults. Understanding these differences is crucial for safe and effective drug therapy in children. Without this knowledge, there is a risk of underdosing or overdosing, which can lead to ineffective treatment or harmful side effects. This is where pediatric pharmacology comes in. It is a specialized field dedicated to understanding how drugs work in the bodies of children. It is the study of how drugs are absorbed, distributed, metabolized, and excreted in children. Each of these processes can vary significantly from those in adults. It also examines how drugs interact with a child's developing body to produce therapeutic and sometimes adverse effects. This knowledge helps in tailoring treatments that are both safe and effective. Pediatric pharmacology is a complex field that requires a deep understanding of both pharmacology and pediatrics. Children's bodies undergo constant change as they grow and mature. These changes can affect how drugs are processed and how they work. These changes affect how drugs are handled by the body, making it essential to adjust dosages and treatment plans accordingly. For example, infants have a higher proportion of water in their bodies compared to adults. This higher water content can influence the distribution of water-soluble drugs. This affects the distribution of water-soluble drugs, potentially requiring different dosages or formulations. Their livers and kidneys, the organs responsible for drug metabolism and excretion, are also still developing. This development stage can impact how quickly or slowly drugs are cleared from their bodies. This can lead to differences in drug clearance rates, which must be taken into account to avoid toxicity or subtherapeutic dosing. The differences in drug handling between children and adults highlight the need for specialized knowledge in pediatric pharmacology. This specialized knowledge ensures that children receive the most appropriate and effective treatments. Healthcare professionals must consider a child's age, weight, developmental stage, and overall health status when prescribing medications. These factors are critical in determining the right drug and the correct dosage. This ensures the selection of appropriate drugs and dosages, maximizing therapeutic benefits while minimizing the risk of adverse effects. Proper dosing is key to achieving the desired therapeutic outcomes. The goal is to achieve optimal therapeutic outcomes while ensuring the safety and well-being of young patients. This requires continuous monitoring and adjustment of treatment plans as the child grows and develops. By understanding the unique pharmacokinetic and pharmacodynamic characteristics of children, healthcare providers can make informed decisions about drug therapy. This informed decision-making is crucial for effective and safe treatment. This knowledge is essential for improving the health and well-being of children worldwide. With the right approach, we can ensure that children receive the best possible care and treatment. Drug absorption is the first step in the journey of a drug through the body. It is a critical phase that determines how effectively a medication can perform its intended function. It is the process by which a drug enters the bloodstream from its site of administration, whether it be oral, intravenous, or another route. This process is influenced by various factors, and in children, these factors can differ significantly from those in adults. Understanding these differences is crucial for effective pediatric care. This can lead to variations in the rate and extent of drug absorption, which can impact the drug's efficacy and safety. One crucial factor is the gastrointestinal pH, which can vary greatly between individuals and age groups. Infants have a higher gastric pH, meaning their stomachs are less acidic than those of adults. This difference can significantly alter how drugs are absorbed. This can affect the absorption of certain drugs that are sensitive to pH changes, making it essential to consider the formulation of pediatric medications. For instance, acidic drugs are better absorbed in acidic environments, while basic drugs are better absorbed in alkaline environments. This knowledge helps in tailoring drug administration for better outcomes. Another factor is gastric emptying time, the time it takes for food and drugs to empty from the stomach and enter the small intestine. This can vary widely among different age groups. Infants have slower gastric emptying times compared to older children and adults. This slower process can influence how quickly a drug begins to work. This can delay drug absorption and affect the onset of drug action, which is particularly important in acute care settings where timely medication effects are critical. For example, Drugs that are absorbed primarily in the small intestine may take longer to reach their therapeutic effect in infants, necessitating adjustments in dosing schedules. Furthermore, enzyme activity in the gut plays a crucial role in drug absorption. These enzymes help break down drugs so they can be absorbed into the bloodstream. Infants have lower levels of certain enzymes responsible for breaking down drugs. This can lead to differences in how drugs are metabolized and absorbed. This can lead to increased absorption and higher drug levels in the bloodstream, potentially increasing the risk of side effects. Therefore, careful monitoring and dosage adjustments are essential in pediatric care to ensure safety and efficacy. Once a drug is absorbed into the bloodstream, it is distributed throughout the body to reach its target site of action. This journey is complex and involves multiple physiological processes. This process of drug distribution is influenced by factors such as blood flow to different organs, which can vary significantly between individuals and age groups. Another critical factor is the drug's ability to cross biological membranes, which can be affected by the drug's chemical properties and the condition of the membranes themselves. Additionally, the drug's affinity for binding to proteins and tissues plays a crucial role in its distribution. This binding can affect both the drug's efficacy and its duration of action. In children, these factors can be significantly different compared to adults, leading to variations in drug distribution patterns. Understanding these differences is essential for effective pediatric care. One key difference is the higher body water content in infants and young children compared to adults. This higher water content can dilute water-soluble drugs more extensively. Water-soluble drugs, such as aminoglycoside antibiotics, will be distributed in a larger volume of fluid in children. This can lead to lower concentrations of the drug at the target site. Consequently, achieving the desired therapeutic effect may require higher doses of the drug. This adjustment is crucial to ensure the medication is effective without being harmful. On the other hand, children have lower body fat percentages compared to adults. This difference can influence the distribution of fat-soluble drugs. Fat-soluble drugs, such as some sedatives and anti-epileptic medications, may have a higher concentration in the bloodstream and a longer duration of action in children due to the smaller volume of fat for distribution. This can result in prolonged effects of the drug, which may be beneficial or potentially harmful, depending on the situation and the drug in question. The blood-brain barrier, a protective mechanism that regulates the passage of substances from the blood into the brain, is also not fully developed in infants. This immaturity can have significant implications for drug therapy. This immaturity can result in increased permeability, allowing certain drugs to enter the brain more easily. While this can be beneficial for treating central nervous system infections, it also raises concerns about potential toxicity to the developing brain. The developing brain is particularly sensitive to toxins, and increased drug permeability can lead to adverse effects. Therefore, careful consideration and monitoring are essential when administering drugs to infants. Plasma protein binding, the extent to which a drug binds to proteins in the blood, can also differ in children. This binding affects the drug's availability and activity in the body. Certain drugs bind highly to plasma proteins, and only the unbound or free fraction of the drug is pharmacologically active. This balance is crucial for the drug's effectiveness and safety. Infants have lower levels of these plasma proteins, which can lead to a higher proportion of unbound drug in the circulation. This increased proportion can potentially increase the risk of side effects, making it vital to adjust dosages carefully. Section 4. Metabolism, the liver's role in drug processing. Drug metabolism is the process by which the body transforms a drug into a more water-soluble form for easier elimination. This process is primarily carried out by enzymes in the liver, and it can significantly affect the duration and intensity of drug action. In children, drug metabolism can differ significantly from that in adults. This is due in part to the immaturity of the liver, which is responsible for the majority of drug metabolism in the body. Infants in particular have immature liver enzymes. These enzymes are responsible for breaking down drugs, and their immaturity can lead to reduced drug clearance and a prolonged half-life of drugs. This means that drugs may stay in a child's system for a longer period, increasing the risk of side effects. Furthermore, enzyme activity can vary significantly among children of different ages and developmental stages. This variability makes it challenging to predict drug metabolism rates in children, highlighting the need for careful monitoring of drug levels and potential side effects. Another factor influencing drug metabolism is the first-pass effect, a phenomenon where a drug is metabolized by the liver before it reaches systemic circulation. This effect can be reduced in children due to immature liver enzymes, leading to higher levels of the active drug in the bloodstream. Section 5. Excretion. Removing drugs from the system. Drug excretion, the process of removing drugs and their metabolites from the body, is the final step in pharmacokinetics. The kidneys are the primary organs responsible for this process, filtering waste products from the blood and excreting them in urine. However, other routes of excretion include bile, sweat, saliva, and breast milk. In children, immature renal function can significantly impact drug excretion rates. Infants have a lower glomerular filtration rate, which is a measure of how well the kidneys are filtering blood. This means that drugs are eliminated from the body at a slower rate, leading to a prolonged half-life and an increased risk of drug accumulation. As children grow, their kidneys mature and renal function gradually improves. However, it's essential to remember that renal function reaches adult levels around 2 years of age. During this developmental period, drug dosages may need to be adjusted to account for the changing excretion capacity of the kidneys. Monitoring renal function is crucial when prescribing drugs to children, especially those with pre-existing kidney conditions. This can be done through regular blood tests that measure creatinine levels, a waste product that reflects kidney function. Urine output and urine drug levels can also provide valuable information about drug excretion.